In today's video, I'll be talking about and demonstrating nasopharyngeal suctioning. The first thing you want to do is verify the suction order in the patient's medical record. Then you want to verify the patient by asking their name and date of birth. You want to assess their lung sounds, as patients who need to be suctioned may have crackles or gurgling present. Next, you want to assess their oxygen saturation level, as it usually decreases when a patient needs to be suctioned. Next, you want to assess the respiratory status, including respiratory rate, rhythm, and depth. Patients may become tachypnic when they need to be suctioned. Assess the patient for signs of respiratory distress, such as nasal flaring, retractions, or grunting. Next, you want to assess their effectiveness of coughing and expectoration. Suctioning of the airway may be necessary for patients with an ineffective cough who are unable to expirate secretions. Assess the characteristics and amount of secretions while suctioning. You want to assess the patient for pain or the potential cause of pain. Administer pain medication as prescribed before suctioning. To minimize trauma to the airway mucosa, suctioning should be done only when secretions have accumulated or adventitious breath sounds are audible. Suctioning stimulates coughing, which is painful for patients with surgical incisions or other conditions. Next, you want to position the patient. If the patient is conscious, you want to place the patient in a semi-Fowler's position. If unconscious, you want to place the patient in a lateral position facing you. A sitting position helps the patient cough and make breathing easier. Gravity also facilitates catheter insertion. The lateral position prevents the airway from becoming obstructed and promotes drainage of secretions. You want to make sure you explain what you're going to do and the reason for suctioning the patient, even if the patient is not alert. Reassure the patient you will interrupt the procedure if he or she indicates respiratory difficulty. Next, you want to assess the nares. You want to assess for a history of a deviated septum, any nasal polyps, any nasal obstruction, injury, epistaxis, which is nasal bleeding, or nasal swelling. Now that you're ready to do your patient's nasopharyngeal suctioning, you want to bring the bed up to a comfortable working height and bring your bedside table to waist level. I practiced hand hygiene and also made sure that my table was clean. You want to place a pad across the patient's chest for protection and turn your suction on to no more than 150 millimeters per mercury for adults. So I'm going to do that. Next, I'm going to gather my equipment. You want to open up your package using aseptic technique first. Then you want to open up your basin and place normal saline water into it. Then you want to open up your lubricate and being careful not to touch the package because this lubrication is not sterile. You want to put it in to the packaging here. And then you want to increase your patient's supplemental oxygen level. And then you want to put on your proper PPE. So what I'll be doing is putting on a mask and also putting on sterile gloves. Next, with my dominant hand, I'm going to pick up the catheter. And then with my non-dominant hand, I'm going to pick up the suctioning tubing and I'm going to connect it. Now that my tubing is connected, what I'm going to do is I'm going to check the suctioning level. So I'm going to take my tubing and dip it in to the normal saline, and then I'm going to suction it by pressing the top here. And it is suctioning well. I'm going to ask the patient to take a couple deep breaths, and I'm going to lubricate the tip of the catheter 2 to 3 inches. And then, as I'm doing this, I'm going to take away the oxygen before I start suctioning the patient. And without touching the patient's face, I'm going to measure the distance for insertion from the patient's earlobe to the nose. This will ensure proper placement. Next, I'm going to gently insert the catheter into the nares, and you don't want to force it. and you want to move along the floor of the nostril towards the trachea and roll the catheter between your fingers to advance if necessary. You're going to advance the catheter into the nares, at least 5 to 6 inches to reach the pharynx. And you don't want to apply suction as you insert the catheter. So now that I'm in, I can start suctioning. And you want to suction in intervals. You don't want to suction more than 10 to 15 seconds at a time. Quicker suction times may effectively clear the secretions. Now that I'm done my first round, I'm going to take the tubing out, and I'm going to allow 30 seconds to 1 minute between suction attempts, and I'm going to clear the tubing by suctioning up the saline. Now that my tubing's clear, I'm going to alternate the nares, and then I'm going to start my suction again, doing the same technique. And I'm going to clean the tubing. Okay, I'm finished. You want to make sure that no more than 3 suction passages should be made per suctioning episode. You want to also make sure that the patient performs oral hygiene. Now I'm going to clean everything up and turn off my suctioning and make sure the patient is in the lowest position in the bed and comfortable. When you have finished with your nasopharyngeal suctioning, you want to make sure you reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds. How do you know when you've been successful? The expected outcome is achieved when the patient demonstrates improved breath sounds and has a clear patent airway. Other outcomes are that the patient will exhibit an improved oxygen saturation level, and the patient will demonstrate effortless respirations within appropriate range without respiratory distress.